Hey peeps, how's it going? I'm glad to see y'all here. Dead Mother Amanda. I apologize for being late. I wanted to get here at 3, not 4. Had an unexpected but welcome visit from someone at 3 o'clock, right, just before 3 o'clock, which is totally great and awesome and cool. Talking about insurance and healthcare and stuff like that with a person that I was talking with. Um, so yeah, I want to talk about gender dysphoria, um, insurance, and yeah, kind of what it's like. Some of the things that I've been through already. I've had vocal feminization surgery already. I've had breast augmentation. I've been on hormone replacement therapy for now almost 5 years, going on 5 years, a little before 4 years, 3 months almost to the day. Um, yeah, I've had I said vocal feminization surgery and breast augmentation. I'm not sure which one was felt worse, the breast augmentation or the vocal surgery. Because what they did for the vocal surgery is what they did is they brought some of the top of my vocal cords together, laser fused them and put a couple of stitches there to shorten the vocal cords. And it took some time to heal. I couldn't talk for a while at all, and then just a little bit at a time. It's a work in progress. It's been a work in progress, and I think it still is to some degree, and a work in process. Progress. And before I started, I had the vocal feminization surgery. I did go through some vocal training. I went down to through Mount Sinai in New York City, and it was Dr. Corey. Um, he was great. He's a great doctor, and Dr. Goldberg for vocal therapy. Um, they're great, and they really are. And so I got into it. I did some vocal therapy before surgery and did some vocal therapy after. And it all helped. Like I said, yeah, as you can tell, it's still a work in progress after over a year later. It's still a work in progress. Um, it was done in August of 22. So it's been going on for it's been 2 years, almost two. It'll be 2 years this coming August that I had the vocal feminization surgery. Got lucky that my insurance paid for it. One thing that's tricky about some insurances and doctors and stuff like that, not all doctors take all of the insurances that are out there for gender affirmation treatment and care. So just like a search and see, and I'll get a couple of go to a few different doctors and surgeons for what you're looking to get into to have done for transsexuals, the reassignments, surgeries, and medical care. um, got a wonderful hormone therapist up in at the Bassett Healthcare in upstate New York, up in Oneonta, New York. The Gender Wellness Center up there, they're good doctors. Dr. Wolf Gould is my hormone replacement doctor there, therapist at the Susquehanna Family Care, up in Oneonta, New York, at the Gender Wellness Center. Um, yeah, she's not the first doctor I went through, though. Went through a doctor, started my hormone therapy at Upstate Medical in Syracuse, New York, and ended up switching. The lady that was treating me there she's a sweetheart. She really is a sweetheart. Very understanding, caring, and compassionate. We had a little bit of difference on how much I needed for hormone therapy. The way I was feeling with energy and stuff like that with my hormone levels, I wasn't getting enough of what I needed for the hormone replacement therapy. And when we talked about that, my prescription was reduced. So I chose. I went to the Gender Wellness Center up at Oneonta, New York, through Susquehanna Family Practice, and things have been going good. And on the estradiol tablet, 2 milligrams, and plus I'm on the injections. The injections are every 2 weeks, 0.5 milligrams. And it seems to be going good. My estrogen levels are decent. Um, they're they're definitely livable, absolutely, and they're probably almost twice as high as what they were for right around twice as high from what they were from before. I'm not saying that the treatment for that I got from the doctor was wrong. It just wasn't right for me. Okay, it might be right for you or somebody else if that's what you're going to do from Upstate Medical in Syracuse, New York. Okay, so please, if you're anybody's in New York and goes there, please don't let my experience tell you not to go. That was just my experience. Okay. Um, Next, I think they've got good. I believe they have good doctors there too. And if nothing else, it's a start, and and it may be a doctor you keep for the rest of your treatments for hormone therapy. Um, so, with that being said, you're not getting more than one. Get more than one consultation from any doctor you see when it comes to hormone replacement therapy, and it's in your best interest to do that. So I started my hormone replacement therapy in December of 2019. Yeah, a little over 4 years, and in 4 years, four more days, it'll be 4 years, 3 months, and things are going good there in that area, and I'm happy with that. Of course, I talked about the vocal feminization that I had done. I had that done, like I said, in August of 22. And then my next surgery I had breast augmentation done in March 2023. So it's been almost a year. Okay, I had it done with Dr. Elizabeth Lax, who's in the same medical practice at Bassett Healthcare. She got an office in Cooperstown, New York, and she does do some work out of the office right between Cooperstown and Oneonta. Had the breast augmentation. She did my breast augmentation in Oneonta, New York, at the hospital, Bassett Hospital in Oneonta, and that went well. One thing is some of the the support for the right breast and stuff like that implant, separated a little bit. So we're gonna have to go back and shore that up, a little bit. It's not too horrible. Sometimes there's a little bit of pain every once in a while on the bottom right side, and I'm happy with that. It's definitely helped with the gender dysphoria, and also with that one little small detail, I'm still happy with that. And I got it scheduled to because I've lost weight. I went to had bariatric surgery done in 2021, November 21. So she's gonna also when she goes in to do my breast, she's gonna help take care of the excess skin from the weight loss because I've lost over 100 pounds. I lost about 125, about 120 pounds so far, which is great. And there's some more I want to lose, so that's going good. It's going in the positive direction. And yeah, I was and I had to wear a oh god it's kind of like a binder, but it's not a binder. It's a binder, so to speak, but it's to keep the after the surgery, after breast augmentation surgery, to keep everything where it's supposed to be and solid so it can heal. I think I had to wear that for I think right around 2 months, if I'm remembering right. But I could take it off for showers, and which is kind of cool because if you've had any ace bandages, you can tell them, if they've been on too long without taking care of hygiene. But that went well, so I'm looking forward to that. That went well. Yeah, the next surgery is, I'm not sure which one it's going to be yet. I had a consultation for bottom surgery and a consultation for facial feminization surgery. I was originally scheduled to get the bottom surgery done December 4th of 2023. There's a lack of enough finances. I wasn't able to do that in December, so we rescheduled it for June 7th of this year, 2024. And I'm hoping to be able to have enough to be able to stay down in New York City for at least 2 weeks because you got to be close to within an hour of where you have the surgery for bottom surgery. And their minimum, the minimum is usually 2 weeks, preferably 3 or 4. I don't know. It's difficult saving up money, being on Social Security, and trying to find another job to be able to save up some money to be able to do that. And I'm 54. I'm on Social Security disability, so I've been out from work for a while. Was working part time for a little bit, but that job ended. So it's been really difficult trying to be able to save up for that and the hair removal, electrolysis for hair removal. My hair is too light for laser treatments, so I get the electrolysis done. And I think laser hair removal is probably for people who can get it. They have the darker hair and can get it done. It's really good. The electrolysis, as of right now, is still the only 100% permanent hair removal once it's done in any particular area of the body. So I think even if my hair was darker, I could do the laser. I believe I would still do the electrolysis for the more permanent hair removal. And as they go in with the needle and it burns the root into the root follicle, so it doesn't grow back in that particular follicle that they take it from, the hair from. And for surgery like that, like the bottom surgery, you don't want any hair to right inside. You just don't want that. So even if you could get the laser hair removal, I would still recommend the electrolysis for for preparatory bottom surgeries because it is 100% the only one that's 100% removal once it's been removed. And that's just for health reasons after the surgery, after the bottom surgery, whether it's for vaginoplasty surgery or phalloplasty surgery, because it's better on the permanent removal. Um, so I'm hoping, even though it doesn't look good right now, I'm hoping that I might be able to get some extra help for that for the stay down in New York City. Um, I've seen a few places. I'm probably going to use an Airbnb. Those hotels are so expensive. I checked prices for the hotel that they use for a 10% discount. I think it was a 10% discount that they have for one of the hotels that they use down in New York City. And for 14 days, it was still on nearly $7,000. And it was 6,800 and some odd dollars for 2 weeks. For an Airbnb, I'm probably going to be able to save probably at least $4,000 for a 2 week stay. And I could probably do a 4 week stay for probably at least $3,000 to $4,000 less than I would be paying at the hotel for 2 weeks. And it's still gonna be really tough to afford for some people that are on low income. It's extremely difficult to afford that unless you live close anyway to where you're having the surgery, the bottom surgery or the facial feminization surgery. And the reasons that they want you to stay there for X amount of time is because of any complications that might arise after surgery. And I think typically most of the time, not all of the time, most of the time it usually goes pretty smooth. And there are sometimes that people have had to go in and redo some stuff after the surgery because there are a few maybe small complications, um, especially like with the bottom surgery because of the space between the prostate and the colon is so tight. Could accidentally, because people are human. I don't care who they are. It's just a part of life. People are just human, and sometimes little minor slips happen, and a fistula could happen, and feces could come through the neo vagina, and that's not going to be good because it leads to some serious infections, and that's not good. And that can bring out a lot of different complications on top of having to have another surgery to repair the fistula. And fistula is just a tear, is what it is. Or the prostate could be slightly nicked. Um, they do it with robotics. With what the type of surgery I'm getting is going to be done with robotics. So I'm going to have a peritoneal pull through vaginoplasty. Because with hormone replacement therapy and estrogens, typically most of the time, there's some length that will be lost that would help out for that surgery for the vaginoplasty surgery. So that's what I'm going to have done. I think if they still would have had the length, I would have had the choice. I think I would have chose the peritoneal pull through anyway. And the reason for that is because there's the peritoneum. It's what it is. It's a thin layer that lines the organs, and it's self lubricating. Um, it doesn't lubricate like the vagina does. It doesn't, but there is some lubrication there, and it's not a perfect way to keep it clean, but it does help. Um, having to douche after that. Yeah, I'm gonna have to end up douching after that. Which is okay. I don't have a problem with that. And um, yeah, it's gonna be interesting. It's gonna be fun doing a lot, and I'm gonna have a lot to dilate after that quite heavily for a while. Then it can decrease over time. So I'm looking for that. And like I said, I did have the consult for facial feminization surgery, and um, sent in all the stuff that was really needed for the insurance approval, and they ended up denying the payment of any of it. And that's, oh my good lord, it's like, yeah, depression with that. Um, with that decision. Of course, we're going to appeal it. And hopefully, with the appeal, it'll go through and be approved. And still gonna have to save money to stay down there for X amount of time for that one in New York City. After that's been that surgery happens, and for the bottom surgery, that's probably gonna be at least a 4 hour surgery, and the facial fem surgery could be 4 to 8 hours. I'm sure it's absolutely going to be more than 4 hours. May not be 8, but it could be up to 8, maybe a little more, depending. Gonna have a lot done with that. So, and I'm also looking to hopefully start a nonprofit and for help with people who need to stay down in different area for however long you need to stay for after those types of surgeries, and just work maybe from there, do some other stuff with that nonprofit for transsexual patients, transgender patients that are doing a medical transition. And transgender was supposed to take over transsexual, meaning medical, and transgender has become such an umbrella term. It's like doesn't mean what it's supposed to mean. As anybody anymore can say transgender and not medically transition, which is why it's wrong. I don't believe in that. If you're transitioning, transgender, it's a medical transition. Not, well, I identify as something else and not do anything. Um, yeah, and I'm probably gonna do another online thing about that part of it, the transgender thing. And I'm probably not in this one, and not in this one, other than what I've already said. And I'll just keep plugging along, and keep up with if you're trans, and keep up with your with mental health. I've got 2 therapists, and I'm glad I do. Not everybody needs 2 therapists. I probably don't need 2 therapists, but I have 2 therapists anyway. Um, and it's a good idea. Well, I say having one is definitely for good idea if you want them for certain things you need to get done for your medical transition, and just a therapist, ongoing therapist. One of my therapists is paid, the other one, because of income, is not paid, and that's a help. It really is. And both therapists are great. They're awesome. They're up in the Syracuse area, and yeah, it's just sometimes we need help. Just talking some stuff out, and finding out where things come from when it deals with ourselves and our mental health. Because gender dysphoria is, of course, anybody who's got gender dysphoria, we know that depression can happen, and sometimes it can get really bad. Um, so I don't like talking about a lot, but some have gotten even suicidal ideations and stuff like that. And somebody to have somebody that we can go to talk to, and if needed, get antidepressants and anti-anxiety medications and have that treated as well. Um, because if our mental health isn't taken care of going into surgeries, most doctors will not perform the surgeries if they think that mental health isn't stable enough. And I agree with that, because we need to have our mental health taken care of, and, so we can, even if we're not transgender or transsexual, have gender dysphoria, anybody that's suffering with depression or anxiety, stuff like that, it's always a good idea because our mental health is important. It really is, and we shouldn't have to suffer. We don't need to suffer, chronically, and life happens, and sometimes people don't. Not everybody gets depression. Um, I'm one of those that has it. On top of gender dysphoria, so yeah, it's about me taking care of my health, and yeah, the positives that come out of it, and it's just nice to know that that can be available. If you're struggling, if you're afford to do some research, because there might be ways. There's usually always ways where it can be affordable, low cost, or in my case, I got a free one that doesn't charge. And it's great to be able to have those options. Sometimes it just takes looking into it to find out what you can afford, what you can't afford, and finding a avenue to go so you get the mental health taken care of. It's not a weakness to have that, and then take care of it. That's the responsible thing to do, to take care of mental health. 'Cause we all deserve to have the best life that we possibly can. Um, and yeah, we all need that hope, and to know that we got people on our side that are willing to help. So yeah, if you would mind helping me with the nonprofit I want to start for helping trans patients get to where they need to for their health stays after surgeries, that would be great. And I want to start at least there, and then build onto it over the course of time. For build on other stuff for the nonprofit can make available to trans patients in the trans community. So anyway, and I think I want to end it there. And I just hope y'all have a great rest of the day. And if no one has told you that they love you today, I love you. Thanks for stopping by.